Good evening, everyone, and a very warm welcome to our very first journal club. So, today the topic which we are going to discuss is an interpretable artificial intelligence approach to differentiate between blastocyst with similar or same morphological grade. It is a very recent paper which is published in a very high impact journal, Human Reproduction, in 2025 with an impact factor of 6.8. So this study was conducted by Liao et al. And since this paper has been published, it was cited in 13 different research papers. So before moving further and discussing about what is the background of the study and what was the methodology, we will try to explain why we chose this paper. So in IVF labs, we highly rely on morphological gradings for embryo selection. However, despite standardized grading systems like we follow Gardner's classification, we frequently encounter multiple blastocysts with identical morphology, making embryo prioritization challenging. So this subject is highly relevant because morphology alone does not always capture the biological difference between the embryos. But with artificial intelligence rapidly entering the reproductive medicine, the question is no longer whether our AI can assist embryologists, but how it can provide clinically meaningful information that complements the expertise. So before moving further, let us understand the Gardner's grading system, which we are following across all the SNE hospitals. So for Gardner's grading system, there are three different parameters. First is blastocyst expansion. Then we have ICM grading, and then we have trophectoderm grading. So let's understand how blastocyst expansion grading works. It grades from 1 to 6. The 1 is the early blast, which is like we have a small blastocyst cavity that is less than half of the volume of an embryo. So as in the first picture, you can see there is a little cavity around here, which is very less than the half. And in second one, the cavity is almost half the blastocyst. That means this blastocyst has been started expanding, but the zona is not thin. See, we have zona here, and the zona is exactly intact. Now in third, we have expanded blastocyst, in which the blastocyst occupied the entire embryo with some thinning of the zona. 4 is fully expanded blastocyst with blastocyst occupying more volume than previous stage with stretching and zona thinning. See, in third and fourth, we can see there is a difference between zona here. In fourth one and fifth one, zona is more thinner than third one. In fifth, we have a little protrusion of the blastocyst, which is like it's started to come out. And sixth one is completely hatched blastocyst. So these are the gradings we use for the blastocyst expansion. So when we say 4AA, the 4 we are talking about is the blastocyst expansion. Now coming towards the inner cell mass. So inner cell mass, in the very first picture, we have A. Inner cell mass is categorized, inner cell mass and trophectoderm both are categorized as A, B and C. So in inner cell mass, A is compacted, well-defined and well-organized ICM cells. So you can see that this here ICM is very well-defined and very compacted, and you can clearly make out that this is the A grade ICM. In B, there is few group of cells which are loosely packed. See, here we have a compacted ICM, but exactly with the compacted ICM, we have a few cells which are not that defined and not well organized. In the C1, you can clearly see that it is very poorly defined. Similarly, with trophectoderm, if the cells are well defined, uniformly layered, and tightly compactedly packed, here in the first image, so it is A. If they are moderate, it is B. See, in the upper edge, we have well-defined, tightly packed cells, and here we have a loose and few defined cells. In the third one, we have all poorly defined trophectoderm with few larger cells. Now, moving towards, if two blastocysts, which are exactly the same Gardner's grade, would also choose the same blastocyst. So if we have two different embryologists and we have to choose the blastocysts which are exactly identical, are we able to choose the one for transfer or vitrification? No, we are not. We cannot make out that both within the both 4AA, which one is better to transfer if they are identical. We have to rely on the probability. Then the second question is, are those embryos truly biologically identical? Answer is no, they are not. So this paper tries and attempts to answer these questions using interpretable artificial intelligence. So what was the study? They have conducted the study in 3 phases. First, they developed the model. They developed the model named BlastScoringNet with 2,760 blastocysts, measurably with the Gardner's grading system. Then they clinically validated with the live birth rate and AI-generated blastocyst scoring correlation with live birth rate. Then they did an external validation with independent IVF centers and 476 blastocyst live birth database, and tested models also. Now moving towards the material and method, it is a retrospective observational study and AI generated continuous ICM and trophectoderm scoring using predicted probabilities rather than discrete grade, the Gardner's grade. So ICM and trophectoderm scores are combined using odd ratios to generate an overall blastocyst scoring. So they are taking care of ICM, they are scoring the trophectoderm, and then they are giving a number on the basis of combined OR score. And then they have evaluated with the live birth rate. So what does the external validation assist? They see differentiate imaging system, they saw different embryologists, and then they saw different live birth rates. Okay. Now the problem with the Gardner's grading system is there are only 3 buckets. Either it is going to be A, B, or C. But in normal scenarios, it's not very differentiated like A, B, and C. Sometimes it is a little towards A. Maybe I feel that this is A, somebody else will feel it is B, and other person will see that it is also A. So it's not this differentiated, it is like this. So there is an overlap of differentiation in this. So blastocyst with rare difference in quality often lands in the same bracket. Okay. And the results are that the embryologist often cannot tell which same grade blastocyst. See, if the grading is different, everyone can make out that this we can transfer and this we are not going to transfer. The problem only comes when there are two identical blastocysts with 4AA and we have to choose one for transfer. So they are trying to solve this problem in this. So this was the model which they have prepared. In this model, in this model, they generate a picture and then they feed the picture to the system. The picture is going to encode and give the probabilities of A, B, C in terms of ICM, trophectoderm, and the expansion. And the complete weight is then inverted into the score. That score is going to decide which embryo is better to transfer if we have the same category. For example, if we have in both these pictures, the ICM is of A grade. If you see this one and this one, both the pictures are exactly same and ICM is also perfectly fine. So if I have to grade it, it is A and A. And if I have to choose one for transfer, I can choose any one of it on the basis of probability. But when we feed this image to the model, the model said that the probability ratio for this ICM scoring was 2.998 for the first picture and 2.499 for the second picture. So the grading is similar, but there are 3 very different confidence intervals. So if I have to choose, I would have choose any one of these. But if system give you a number, it is going to take this one, 2.9. So is this 2.9 is correlated with the live birth? Yes, this 2.9 was correlated with the live birth and they had the higher live birth than as compared to 2.4. Similarly, with trophectoderm also, the things are exactly the same. The TE is good in both the categories. You can see the cells are tightly compacted and the score for the first picture is 2.99. And but the model which predicted it, it says that the more than 21 cells are cohesive and they are tightly packed. And in the other picture, there are 18 cells which were tightly packed. So for a human eye, it is a little difficult to count all the cells if it is this less ratio. For the second picture, the score was 2.779. So if we have to choose, we will choose the, according to the model, we will choose 2.996. So though both carries meaningful and more weightage towards towards the B category. So this one is A, completely A, and this one is almost tipping into the B. So if the score system comes to 16 or 15, it will tip into the B. But because it is 18, it is still A, but borderline A. So what was the result said? So the higher ICM and trophectoderm give the higher live birth rates. So there were three different quintiles. The paper split all the blastocysts into 5 equal categories, 20% each, and based on their BlastScoringNet score from lowest Q1 to highest Q5. You can also see that in Q5, the results are extremely higher in live birth rate, 56.8%. Assuming that there is a relationship between the model prediction and the live birth rate. So here also there are different scoring system with the in compare with the maternal age, and which is less than 35 and more than 35 category. In ICM, if the Q5 is higher, Q5 is the highest. In highest one we have 54.15 percentage live birth rate in all cycles. Less than 35 and more than 35. If we have to see more than 35 only, it's 45, and we have to see less than 35, it is 63.4, which is extremely high. And TE in Q5 is 51.5, and if we have to see more than 35 category, it is 49.7. Similarly, the OR combined, it is also higher, and this 55.8%. So there was, with like every study, there were limitations in this study. It was a retrospective study, retrospective and observational study. So we need more prospective randomized trial if we have to go towards this pathway. And the wider implications for the BlastScoreNet, it offers an interpretable quantitative approach to blastocyst assessment that aligns with the Gardner grading system. Its strong association with live birth outcome and validation across multiple centers highlights its potential to support embryo selection and improve clinical decision making. But there are a few things which we have to see, that the retrospective nature is very evident. We cannot completely move towards it. Also, these studies were done in China and only on the Chinese models and IVF centers which were in China. No external IVF centers and external models like embryoscope was used. So the next step for this is going to be the prospective multicentric trial with live birth at the primary endpoint. So we already know that the two embryos with the same morphology do not always produce the same clinical outcome. So this study offers a practical way to distinguish those embryos using explainable artificial intelligence. I hope you have got something from the journal club today. Thank you so much for your time.
Thank you, Nancy. You have very timely and briefly explained everything. Now, for another 5 minutes, we are open for any discussion if anyone wants to discuss. And later on in this group, we will plan what next such discussion we can take. So, if anybody wants to ask anything like the grading which she explained initially, this is for the clinician prospect. I am saying the 4 AA embryo we are using or whatever 1 AA. This was the explanation, and then after this study is further more elaboration, how more precision we can have. So now everyone can unmute, and if any questions are there, then we can discuss them.
Sir, I have a question. Nancy very nicely explained.
Thank you.
I have few queries. One was, you said that it was retrospective and in China and all that is true. When you say that when you are grading or when the clinician embryologist is grading, they both seem to be same, but they have given that ratio of 2.9 and 2.4,
Yes.
and you said the live birth rate is higher in the one which was showing 2.9. So how much higher as compared to 2.4?
Ma'am, if it is 2.4, it will according to the model. So this model has given different gradings. If it is more than 2.5, it comes in the A category. So we don't do it like this. We only do A, B, and C. So this model is designed in a way that it can calculate in the number. So if it is